It's the Newsmaker Hour. I'm Brian O'Neill. Right now, we're turning on our Newsmaker lines and checking in with Steuben County Manager Jack Wheeler. Jack Wheeler, thanks for phoning in.
Thanks for having me, Brian.
Well, things are calming down, and different people have been saying that to me on the phone, that they hear the news and they say, well, there's less cases and a lot less cases in Hornell. So am I correct in saying things seem to be heading back to normal as we enter into phase one, Jack Wheeler?
Yeah, absolutely. We're very pleased that the new positive case counts, are one a day or less. We've had a number of days with no additional cases, so we're very thankful for that. It's at the height of this, we were seeing over 10 cases per day. So, and obviously, tragically, multiple deaths. But yes, I think we're, on the right path. Our curve is on the downward slope. Doesn't mean the fight's over, but we're definitely heading in the right direction.
Just a guess here, but based on the emails and the times that I get the emails, it looks like your Department of Emergency Services and your county public health department probably put in a lot of overtime over the last 8-9 weeks.
Yeah, it's been a crazy time. I give them and all of our essential workers and all the essential workers out there a ton of credit. Throughout the county, I think people have done a fantastic job. We've staffed our emergency operations center with folks from public health, emergency management, and myself since March 14th. We've been out there almost every day. Thankfully, we've been able to take the weekends off, past couple weekends. But, it's been a very, very busy time. But the response that we've had locally, I'm very proud of.
The test supply for COVID-19 tests. Different politicians have said different things about the test supply at different points. This is Tuesday, May 19th. How's the supply for the COVID-19 tests at this point?
You're absolutely right. Always a challenge. We do know that testing supplies are some of our most critical resources. Thankfully, it seems like some of the stockpile that New York State has had is starting to flow upstate. So I know that nursing homes are getting direct shipments of testing kits. I know the county has received about 2,000 testing kits where, up until then we had received 150 since the beginning of COVID. So testing supplies are coming out in greater order now, but the concern that we have is more on lab capacity. Because based upon the number of people who are essential workers going back to work might want to test, and then also the requirements and mandate that the governor has for testing nursing home staff twice a week. Our conversations have turned to more of the logistics side of trying to help nursing homes and others find lab capacity so that we're not waiting multiple weeks for test results.
Yes, that was one of the questions I was going to ask you. How is the test supply for the nursing home? The nursing home situation has definitely calmed down. We're getting a lot less reports about that. That must be a relief to you, Jack Wheeler.
Absolutely. It's been a real challenge. In upstate rural county, we are among the most hardest hit, certainly for a rural county, and a lot of that is due to nursing homes. It's tragic. It's heartbreaking. We've had to be, as proactive as we possibly could be, pushing, the New York State Department of Health for testing in nursing homes. And in some cases, if they weren't responsive, we conducted the testing ourselves. So it's been a challenge. It's been probably the most difficult part about this whole response, the most tragic part, certainly in my view, because you have folks that can't see their family, who are the vulnerable and frail population that unfortunately have been highly impacted by this. As you mentioned, luckily we see things stabilizing. We're finishing universal testing of staff and residents at the final nursing home in Steuben County. So we have completed that. The good news are the results for the remaining nursing homes are coming back with almost entirely negatives, which is great. So I think you're right. I think we're in much more of a stable place with nursing homes.
2 tests a week for now. That's for the workers at nursing homes. What about the patients at nursing homes? I'm guessing that rule does not apply to them.
You're correct. So it's for staff only. The testing for residents, based upon Department of Health guidance, is encouraged if certainly someone is symptomatic or had exposure to either a positive resident or a positive worker. So testing of residents will still continue, but the mandate from the governor is testing of staff twice a week. And based on our track record, we are very supportive of testing in nursing homes, but this is one of the largest logistic challenges that we're fighting. It goes back to the lab capacity issue, because twice a week is very, very frequent. And if the labs can't keep up with the capacity, a staff member could receive multiple tests before even getting their first result back, which is, not an effective policy. I know that the governor is talking about expanding lab capacity throughout the state, but that still is a challenge. So we've worked certainly with Congressman Reed, Senator O'Mara, Assemblywoman Burns, Assemblyman Palmisano. All the electeds have been fantastic throughout this process. And, we're trying to work with the hospital systems and the nursing homes as best we can to, help coordinate.
Hoping you can refresh my memory here. At one point, Darlene Smith, Steuben County Public Health Nurse, put out a statement thanking all the nurses who helped out finding out. I believe this was for doing lab work to find out what the test results were. And Darlene Smith said, "Hey, without these nurses volunteering." And I think these were both school nurses, am I correct, Jack? School nurses and student nurses who helped determine the results of all these COVID tests. Am I correct there?
Yeah, we utilized school nurses who volunteered, and also some other volunteers, staff, and nurses to conduct the testing in nursing homes. Steuben County has a small public health department. We have 4 registered nurses, and they are spending their time on contact tracing and daily check-ins of positive cases. So they're currently engaged and didn't have the ability to go out to the nursing homes and test. So we were left in a position of either finding other contract nurses, but we're a small community. I know a number of school nurses here in the Bath area. And we just reached out and said, hey, we need a little help. And they immediately said, what do you need? And it was actually the next day that we needed them. They said, we got it. And we've had about 7 of them help us out throughout this process. So they've been absolutely fantastic.
That's got to be a enormous relief to you, and what a help those nurses were. Phase 1, we're into that now in Steuben County, also Livingston County, and today is day 1 of Phase 1 for Allegheny County. Might touch on that later, how Allegheny County in the western New York region, after pressure on Albany, the state changed its mind. Now, you had sent out a statement with concerns about some of the, how do I phrase it, paradoxical, contradictory type orders, that some of the executive orders and some of the orders from Albany on Phase 1 and how those had been written and how confusing it was. Wondering, were there any changes heard by the state on the concerns that you and the Steuben County Legislature voiced on Phase 1?
Yeah, so I, on behalf of Chairman Van Etten, sit on they call it a regional control room. So it's the chief executives of our 8-county region. It's from Steuben east to Delaware County. And we have daily calls, and you're right. And it's not meant to be a criticism of the state. I mean, they're trying to figure out the logistics of the whole thing for reopening to begin with, but the frustrating part that we had, or that I personally had, was, which businesses are opening under which phase, to proactively communicate that, because I think sharing that information in as timely a fashion as possible lets folks know when my business can open, what I need to plan for, and, really how long to expect where if they don't, it's uncertainty, it's confusion, it's anxiety. We have serious concerns about that. So we want Albany to, proactively identify when different business phases can open. And then there's specific questions. We talk about outdoor recreation. There were reports, and certainly we worked with Woodhall Raceway and others to say, there are many things that can happen outside in a socially distanced manner for small businesses, whether it be dirt track practices or gun club skeet shoot events or, golf courses, with a single rider in a cart. There's a lot of things that can happen that make sense that weren't allowed. So we keep advocating every day. Some have been changed. Some have not. We're still waiting, and we keep pushing. That's the frustrating part, and that's, what we spend a lot of our time on is answering questions from businesses and trying to help them, communicate to Albany their needs and what's happening in Steuben County.
Talking with Steuben County Manager Jack Wheeler. State Senator Tom O'Mara was on Newsmaker yesterday. He spoke highly of you and your ability to speak out when needed. And O'Mara is calling for a formal investigation into the way that nursing homes were handled. I see on WETM's website they have a story saying that you're calling for what you describe as a thorough review as to Albany's orders on the handling of the COVID patients in nursing homes. Jack Wheeler, Steuben County Manager, you lived through this. You worked through this almost, I don't know if I'd say 24/7, but pretty late hours in some cases, I heard from the different politicians who were on the different phone calls. And I heard from different politicians that, that sometimes the representatives from Albany, from the state health department, that some of the politicians would speak out and say, wait a second, you just said this, now you're saying this, and that kind of conversation went on.
Yeah, you're absolutely right. And all of our, as I mentioned, all of our elected representatives have been absolutely tremendous during this. And I probably had to bug them more than ever before, but they've been so responsive to our needs, especially when it comes to nursing homes. We have had to push. There's no doubt about it. And the state has a tremendous responsibility for response for hospitals, nursing homes, everything. And so, it's not meant to, understate the amount of work that they have done. But when it comes to specific actions in nursing homes, our responsibility is to the citizens and residents of Steuben County. Certainly we care about our surrounding areas, but, our responsibility is for our residents and our citizens. So we're going to advocate and push as much as we possibly can. And when it came to nursing homes, we really had to push the state. They were very responsive at the beginning when we had a couple clusters in nursing homes, but then all of a sudden communication became sparse. We were asking questions, we were asking for help, and it wasn't coming right away. So we had to step up and do it on our own, and we were happy to do that because, it's our, if the state isn't going to step up, it's our responsibility. But, I think in some cases there have been blind spots when it comes to nursing homes. I'll leave it to the electeds to, figure out exactly what needs to happen. But, I think we all need to take a step back, and we'll certainly do it at the county. When this is over, is take a look at, and hopefully we never have to live through something like this again. But if we do, lessons learned, where we succeeded and, where we came up short.
Going to take a quick break. We'll be back in just a moment with Steuben County Manager Jack Wheeler. Stay with us.
Mullen Factory Direct Floor Covering has been serving this area for many years. During life's ups and downs, we've never quite experienced anything like this. There's no official day or time set for us all to go back to business as usual, but Mullins wants you to know they're there for you and your flooring projects. And it's also a good time to say thanks to all the loyal customers and remind you to support all area local small businesses to help them stay afloat during this unprecedented time. Be safe and stay healthy. From your friends at Mullen Factory Direct Floor Covering in Almond.
You make sure his toys don't have any sharp edges. You taught her what to do when the smoke alarm goes off and to wear a helmet when she rides her bicycle. You do so much to keep your child safe. But are you using the right car seat for your child? Car crashes are a leading killer of children ages 1 to 13. Protect your child's future at every stage of life. For information on the right seat for your child, visit safercar.gov/the right seat.
Sponsored by the New York State Governor's Traffic Safety Committee.
Back with Steuben County Manager Jack Wheeler. Jack Wheeler, I wanted to ask you a couple of questions about the unemployment situation in Steuben County. First off, do you have a sense of what the numbers are like at this point?
Off the top of my head, I do not. I know that our Workforce Development Board and our economic development agencies are tracking those numbers. Certainly, I know there has been some press releases, but it is obviously a very concerning issue. We know that processing of unemployment checks and payments have been very concerning. We've been working with state representatives to offer assistance if we can to help break the logjam, but it's an unfortunate situation, and it just puts more stress on folks. Where they're doing the right things, they're staying home, they're shutting down their businesses if they're self-employed, and then they have to wait weeks for payment. It's a troubling situation.
On that topic, we hear everyone from Assemblyman Phil Palmisano and all the other assembly members and state senators to Congressman Tom Reed talking about how their offices are helping people as kind of like go-betweens between themselves and the Department of Labor. Wondering, does your office, the county manager's office, get involved with that task at all of helping people with their unemployment claims?
To a certain extent, but those elected representatives, are the I'd say the most effective advocacy voice. We certainly work with local Workforce Development Board because they have a relationship with the New York State Department of Labor, and we try to advocate as best we can. But the local elected officials have really been the ones to step up and really help with that.
Steuben County parks, now they're open, but with some restrictions. Can you tell us about that? I was thinking places like Catacadia Park.
Sure. Yeah, unfortunately, we did close parks for about 3 weeks there because we were having large groups gathering, and we're sending out, Department of Public Works and Sheriff's deputy staff to just have a conversation, not getting anyone in trouble, but just say, hey, you can't gather in large groups. We shut them down for a while when we were at the height of our local impact. A couple weeks ago, as things started slowing down, we were confident in opening it up, and I'm happy to say things have been going well. We haven't received reports of large groups gathering, but as you mentioned, playgrounds remain closed, and also pavilions, high-touch surfaces. So if you look at any of, most of the municipal playgrounds, school playgrounds, and those things are closed because, you just don't have enough staff to disinfect those surfaces frequently. We do have more staff going out, and, some of the park benches that are, encased in concrete that can't be moved. We have people going out there and disinfecting them frequently. So, we encourage people to go out with members of their own household to, walk the parks, to go fishing, to do those sorts of things, those outdoor activities. That's all good. It's what we're concerned about, and it's not just with the parks, is the gatherings of groups of friends or extended family, because we have seen more than a few cases of those large groups for a bonfire or a party sparked a number of positive cases. So that's where our concern remains.
Wondering, Steuben County Manager Jack Wheeler, if it comes back, the COVID-19, do you anticipate, and I'm sure you've spoken with medical professionals on this, do you think that it would be possible that we would have to go through another shutdown if the COVID comes back in a big wave? Or what are the discussions on that turning up as far as the conversations go?
So we have had conversations about that. The latest that we're hearing from the state and others, certainly if we had a tremendous spike, then sort of all bets are off. But if based upon the governor's requirements for the different 7 metrics that we have to measure on a daily basis, and that's part of the regional control room that we have calls daily, is to monitor those with hospitalizations, ICU usage, deaths, new cases. What our understanding is, if we see a huge spike, it doesn't mean that we necessarily go backwards. It just means that we might not move on to the next phase of reopening as quickly. We're hoping that's not the case. So far, folks are, continuing to do the right things. I know, a lot of people have issues wearing masks. They don't want to do those things. I mean, I haven't seen, close friends or family in a number of months, just like everyone else. And it's difficult. It's not the way, we're meant to live our lives, but, avoiding those large groups, helps us move to a more normal situation here more quickly. So to answer your question, it doesn't necessarily mean if we have another big spike that we go backwards. It just might mean that the next phase of reopening is delayed.
Okay, Steuben County Manager Jack Wheeler, I want to thank you so much for coming on this morning.
Thank you, as always, for having me, Brian.
That was Steuben County Manager Jack Wheeler here on Newsmaker on our live line. Coming up next, Dr. Gary Ostrower. Stay with us.